Namaste, Dr. Rita. How are you? Rita ji? Dr. Rita, are you able to hear me?
Yes, Joseph.
Yeah.
Yes, I can.
Yeah. Okay. Fine. So today, shall we start our program?
Yes, I think so.
Okay, fine. So today we are speaking regarding the GB syndrome. So what actually is GB syndrome? Basically, I will be explaining my experience regarding this initially. So hope so. One of my patient today, he will be coming into the Zoom meeting where he has been carried by 4 peoples, and after the treatment he was absolutely fine, and this is after 10 years of the treatment. He is now doing very well. So in the course of time, I have encountered with many such patients with instant recovery. So I wanted to share my knowledge regarding how to treat the GB syndrome case in very cheap, cost effective and very effective manner. Within a few minutes he will be able to walk. See, I have posted one video in my YouTube channel where you can go through that GB syndrome recovery. You can go through that. That patient around about age 24 or 25 years old, he has been carried by 4 peoples. While he was going out after half an hour, he was able to walk, not very perfectly, somewhat, somehow. The same day evening, he was after 2 days, he had a follow-up to me. I asked him to have a follow-up after 2 days. He had come. When he had come, after 2 days, very miraculously, he was walking like a Mr. Indian, like super. No way, no, you not detect any sorts of deformity or any sorts of problem at all. So even we know that the cost of treating GB syndrome with IgM, IgG, and plasma transfer, all these require much much economy, much money, and but still what happens many a times, we will not be able to save the patient. So let us see and understand what is the pathophysiology of GB syndrome, what it is actually causing the GB syndrome, whether it is an autoimmune disorder or virus induced disorder. So let us know about it. Okay, so we shall start the screen now. Hope this screen is visible to you. Okay, so shall we start?
Yes, it is.
Yeah. So the thing is that GB syndrome is a rare neurological disorder in which the body's immune system mistakenly attacks part of its peripheral nervous system. The network of nerves located outside of the brain and spinal cord. Okay, so starting basically what it happens means the paralysis, ascending type of paralysis is the most common types of symptoms we feel. Slowly paralysis, and the patient is not able to move the leg, not more able to move the toe even. So he falls, total paralysis. Slowly as it keeps on ascending, hand muscles and even respiratory muscles have been affected. And moreover, if at all that thing goes to a higher end, what will happen means there could be a possibility of getting respiratory muscle failure also. So resuscitation methods, so okay, ventilator are also required for this type of disease. GB syndrome can affect anyone. It can strike at any age, although it is more frequent in adults than older people. Okay, and both sexes are equally prone to have the disorder. GB syndrome is estimated to affect about 1 in 1 lakh person. So what causes GB syndrome? The exact cause of GB syndrome is not known. Note this point. It is not known. Okay. The researchers do not know why it strikes some people and not others. It is not contagious even. If you have a person with GB syndrome, it will not spread. Okay, that's damn sure. And it is not inherited even. So where are we actually? We are not able to find the cause itself. So what they do not know is that the affected person's immune system begins to attack the body itself. So what is the miracle? See, so what is the pathetic situation where body's immune system, which has to protect our body, it's destroying our body. So we are not able to understand why it is doing so, because there is a reason and we are not able to understand. We can tell that there is no reason, rather there is some reason which is we are not able to understand. So let us dig deep into it. So let us see whether we get any reason for it. Okay, now coming to it. It is thought that at least in some cases this immune attack is initiated to fight an infection. Okay, basically immune system was triggered to fight an infection, and that some chemicals on infecting bacteria and virus resembles those on nerve cells. So now our immune system is getting confused. So whether to kill the bacteria or virus, or which is more resembling, more having the more resemblance of the nervous system. Getting the point? So it starts affecting our nervous system. Okay, this is one of the possible hypotheses. It's not told that it's damn sure. Okay, next coming to some other things. Since the body's own immune system does the damage, GBS is called as autoimmune disorder. Getting the point? Normally, the immune system uses antibodies, okay, and special white blood cells to protect us by attacking, infecting microorganisms. So in GB syndrome, however, the immune system is mistakenly attacks the healthy nerves. Okay, so most cases usually starts a few days or weeks following a respiratory or gastrointestinal viral infection. Occasionally, surgery will trigger the syndrome. In rare cases, vaccination may increase the risk of GB syndrome. Recently, some countries worldwide reported an increased incidence of GBS following infection with Zika virus. So now let's see, it is being told that due to vaccination, the process of GBS is being triggered, and that could be one of the factors for getting GB syndrome, or that could be Zika virus. Okay, now let us dig deep into it. Zika virus is a member of virus family. Okay, it spreads by daytime active Aedes mosquito, such as A. aegypti, and its name comes from Zika forest of Uganda, where the virus was first isolated in 1947. So vaccination, let us speak about vaccination. In past, vaccination, particularly the flu vaccines used in US during the swine flu outbreak in 1976, were linked to an increased risk of GB syndrome. Why it is so? Many patients, those who has taken the flu shots taken, carried, they take that patient to the doctor hospital by telling that he is being paralyzed. When the doctor has seen that this is GB syndrome, so the possible case were noted, and they suspected there is every risk chances of getting the GB syndrome after vaccination. So let us see whether it is really is that or anything like more. But research has since found the chance of developing the condition after having vaccination are extremely small. Okay, so if you vaccinate 100 or 1,000, if you get 1 or 2 or 5, so that is very negligible. But we cannot say it's not of vaccination. The possibility is low. We can tell that the possibility of getting is low. Okay. So then what are the possible triggering factors? Sometimes GB syndrome appears to have particular triggers. These are some of the main triggers, what is called infections. In most cases, GB syndrome occurs a few days or weeks after an infection. Infection that have been known to trigger the condition include food poisoning, flu, cytomegalovirus, glandular fever, HIV, dengue, Zika virus. But research have been found that chance of developing the condition after having a vaccination are extremely small. So researchers are telling in that way. For example, a study into the vaccine used during the 2009 swine flu outbreak found that every million people who had a vaccination, there were fewer than 2 extra cases of GB syndrome. Maybe the percentage is less than 1% even. Okay, the evidence suggests that you are far more likely to get GB syndrome from an infection such as flu than the vaccine designed to prevent the infection such as the flu jab. So they have told one more thing is that the possibility of getting GB syndrome is more for a particular variety of virus than the vaccine. So more effective is the what you call is the infection, not the vaccine. So when we compare, so components of vaccine. So if you want to study the little bit of vaccine, what it contains and what it does and all, vaccine includes a variety of ingredients, including antigen, stabilizer, adjuvants, antibiotics, and preservatives. So what could be the triggering factor for a GB syndrome? If you go in that way, they may also contain residuals byproduct from the production process. Knowing precisely what is each in vaccine can helpful when investigating adverse event following the immunization, and for choosing alternative products for those who have allergies or have had an adverse event known or suspected to be related to the vaccine component. So if you know what are all the components of vaccine, and whether the person is allergic to any sorts of antibiotics which is used in the vaccine, we can better avoid that vaccine. So getting the point. So antigen are the component derived from the structure of the disease causing organism, which are recognized as foreign by immune system and trigger a protective immune response to the vaccine. So only vaccination will trigger the antigen response. What are stabilizers? Stabilizers are used to help the vaccine maintain its effectiveness during storage. Vaccine stability is essential, particularly what do you call vaccine stability is essential, particularly where the cold chain is unreliable. Instability can cause loss of the diminishing factor. It reduces the effectiveness of the vaccine. And in the same way, adjuvants. What are adjuvants? Adjuvants are added to the vaccine to stimulate the production of antibodies against the vaccine to make it more effective. So aluminum salts. Aluminum salts are more among the oldest adjuvants that are commonly used. They slow the escape of antigen from the site of injection. So aluminum salts are generally recognized as safe. However, they can cause sterile abscess nodules at the site of injections. One more thing, and one of my patient I have told you as previously, as I am taking the class of GV syndrome, so he will share his experience in a few minutes. It's over to Madhu. Madhu, please explain. Can you explain what has actually happened and how you are able to come out of it? Madhu, on the audio and video also. Madhu, are you able to hear me? I think let's continue. I think he's not able to hear. Fine. So he's on the live page, right? So coming to the same thing, antibiotics. So hi Madhu, yes, come. Madhu, matadi. ಮಾತಾಡಿ ನಿಮ್ಮ ಹೇಗ್ ಬಂದ್ರಿ ಯಾವ ತರ ಇತ್ತು ಹೇಗೆಲ್ಲ ಮಾತಾಡಿ.
ನನಗೆ 2013ರಲ್ಲಿ
ಓಕೆ
ಜಿಬಿ ಸಿಂಡ್ರೋಮ್ ಅಟ್ಯಾಕ್ ಆಗಿತ್ತು. ಅಂದ್ರೆ ಜಿಬಿ ಸಿಂಡ್ರೋಮ್ ಅಂತ ಗೊತ್ತಿರ್ಲಿಲ್ಲ.
ಓಕೆ
ಫಸ್ಟ್ ಒಂದು 15 ಡೇಸ್ ವಾಮಿಟ್ ಆಯ್ತು.
ಓಕೆ
ಆಮೇಲೆ ಒಂದು 15 ಡೇಸ್ ಲೂಸ್ ಮೋಷನ್ ಆಯ್ತು.
ಓಕೆ
ಆಮೇಲೆ ಒಂದು 15 ಡೇಸ್ ಫೀವರ್, ನೈಟ್ ಫೀವರ್ ಬರೋದು. ಮತ್ತೆ 75 kg ಇದ್ದವನು 24 kg ಡೌನ್ ಆಗೋದೆ. ಆಮೇಲೆ ಸೆಂಟ್ ಜಾನ್ಸ್ ಹಾಸ್ಪಿಟಲ್ಗೆ ಅಡ್ಮಿಟ್ ಆದೆ. ಅವಾಗ ಅಲ್ಲಿ ಜಿಬಿ ಸಿಂಡ್ರೋಮ್ ಅಂತ ಐಡೆಂಟಿಫೈ ಮಾಡಿದ್ರು. ಮತ್ತೆ ಕಾಲು ಕೈ ಅಂದ್ರೆ ಈ ಬರ್ನಿಂಗ್ ಸೆನ್ಸೇಷನ್ ಅದೆಲ್ಲ ಇತ್ತು. ಆಮೇಲೆ ಅಲ್ಲಿ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡು ಮತ್ತೆ 2000 ಅಲ್ಲಿಂದ ಡಿಸ್ಚಾರ್ಜ್ ಆಗಿ ಬಂದು ಆಗಸ್ಟ್ ಅಲ್ಲಿ ಬಂದೆ. ಸೆಪ್ಟೆಂಬರ್ ಅಲ್ಲಿ ನಿಮ್ಮ ಹತ್ರ ಬಂದೆ.
ಓಕೆ
ನಿಮ್ಮ ಹತ್ರ ಬಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡ್ಮೇಲೆ ಅಲ್ಲೇ ವಾಕ್ ಮಾಡಿದ್ದು ಪಂಚಕರ್ಮ ಟ್ರೀಟ್ಮೆಂಟ್ ಅದೆಲ್ಲ ತಗೊಂಡ್ಮೇಲೆ ವಾಕ್ ಮಾಡಿ ಅಲ್ಲೇ ಡ್ರೈವ್ನು ಮಾಡಿಸಿದ್ರಿ ನೀವೇ, ಕಾರ್ ಡ್ರೈವ್ ಮಾಡಿ ಅಂತ ಎಲ್ಲ. 70% ನಿಮ್ಮ ಹತ್ರ ಅಲ್ಲೇ ಸ್ಪಾಟ್ ಅಲ್ಲೇ ರಿಕವರಿ ಆಗಿದೆ. ಆಮೇಲೆ ಬಂದು ಮತ್ತೆ ಫುಲ್ ರಿಕವರಿ ಆಗಿ ಈ ಕೈ ಎಲ್ಲ ಬೆಂಡ್ ಮಾಡಕ್ ಆಗ್ತಾ ಇರ್ಲಿಲ್ಲ, ಕೈ ಕಾಲು ಎಲ್ಲಾನು ಆಗ್ಬಿಟ್ಟಿತ್ತು.
ಓಕೆ ಓಕೆ ಫೈನ್ ಫೈನ್. ಓಕೆ ಥ್ಯಾಂಕ್ ಯು ಮಧು ಅವರೇ, ನೀವು ನಮ್ಮ ಜೊತೆ ಬಂದಿದ್ದೀರಾ, ನಿಮ್ಮ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಶೇರ್ ಮಾಡಿದ್ದೀರಾ. ನಮ್ಮ ಸ್ಟೂಡೆಂಟ್ಸ್ ಇದ್ದಾರೆ ಹೊರದೇಶದಿಂದ ವಿದೇಶದಿಂದ, ಡಾಕ್ಟರ್ಸು ಸ್ಟೂಡೆಂಟ್ಸು ಎಲ್ಲ ಕೇಳ್ತಾ ಇದ್ದಾರೆ. ಸೊ ನೀವು ಹೇಳುವಂತ ಒಂದೊಂದು ಮಾತು ಕೂಡ ಸಾಕಷ್ಟು ಯುವ ಆಯುರ್ವೇದ ಹಾಗೂ ಇನ್ನಿತರೆ ಆಲ್ಟರ್ನೇಟಿವ್ ಸಿಸ್ಟಮ್ ಆಫ್ ಮೆಡಿಸಿನರಿಗೆ ಒಂದು ಪ್ರಚೋದನೆ ಆಗ್ಲಿ ಅಂತ ಹೇಳ್ತಾ ಥ್ಯಾಂಕ್ಸ್ ಹೇಳ್ತೇನೆ. ಓಕೆ ಮಧು ಅವರೇ, ನಿಮಗೆ ಎಕ್ಸಿಟ್ ಆಗ್ಬೋದು, ಇಲ್ಲಾಂದ್ರೆ ಕೇಳೋದಿದ್ರೆ ಕಂಟಿನ್ಯೂ ಮಾಡ್ಕೋಬಹುದು. ಥ್ಯಾಂಕ್ ಯು. So let's continue. So we have to analyze what are the components of antibiotics. Okay, next coming to preservatives. What are the preservatives added in this? Preservatives are added to multi-dose vaccine.
Excuse me.
Yeah.
भैया वो क्या बोले वो कुछ समझ नहीं आया, उसको प्लीज थोड़ा एक्सप्लेन कर दीजिए.
Actually he had come to me like before to that he has taken IgG, IgM and all the treatments, costly treatment from St. John's, Bangalore. He's a patient from Bangalore and he was not recovered at all. So he was not able to walk and nothing, he could do nothing much. So when he came to me, I treated him. So after that, within few days itself, maybe a stay of 5 to 6 days, so he started walking, holding like he was able to drive the car when he was gone out of the this one hospital or clinic. So he was like before 10 years I'm speaking. So from him he actually sent many other patients of very rheumatoid arthritis, many patients. So since then I had get maybe weekly twice or thrice the patients from Bangalore, around about 250-300 kilometers from my place. So the thing is that he is doing well and no much problem is been encountered. So that's why I would like to give his testimony, where it could be something where when IgM, IgG fails, when plasma therapy fails, within few days what the Ayurveda can do, or what the alternative system of medicines, acupuncture, marmam, what it can do. So I thought it's a very good occasion to call him up for a testimony. So only I asked him, will you able to give few talks? So he agreed and he came to me and he was
very nice. Very nice, Bhaiya. Thank you. Thank
Okay,
you. Yeah.
thank you.
Please continue. Yeah.
Yeah. So we are thinking about the preservatives, whether any preservatives can deepen or worsen the GB syndrome case. So have given they have made, vaccine companies have made almost all observation so as not to trigger any our immune system. So formaldehyde, so it has been widely used to inactivate virus and detoxify bacterial toxins, such as the toxins used to make diphtheria and tetanus vaccines. During the production, the purification process removes almost all formaldehyde in the vaccine. So even though formaldehyde is being added, but during the process of filtration, majority of the formaldehyde is removed because formaldehyde is very toxic anyhow. So the small, a few percentage, we cannot tell that it's everything is removed. Few percentage could be there, which could be a cause of triggering the GB syndrome. But it is not only the all cause for GB syndrome. This could be 100 in one cause. That's it. We are able to explain. So let me move up the things related to the vaccines. So what are the symptoms of GB syndrome? Actually, I have told this. In addition to that, muscle weakness, I have told this. Then what happens? Okay, what happens in GBS? Many of the body's nerves are like household wires. There is a central conducting core in the nerve called as axon that carries an electrical signal. The axon is surrounded by converting like insulation, covering like an insulation, just that is called as myelin sheath. So what happens? The myelin sheath surrounding the axon speed up the transmission of nerve signals and allows the transmission of signals over a long distance. Getting the point? So whenever the myelin sheath has been affected, what it happens means it slowly reduces the power to flex and extension, walk, everything. It will be very slow, as if he is not having any power, as if he has got occurred any stroke process. Something the process keeps on slowing. As this virus or the autoimmune system slowly destroys nerve by nerve, has on the ascending paralysis occur, and the possibility of death also could be high in certain cases if you are not treating properly. Weakness. So when we move, for example, an electric signal from the brain travels through and out of the spinal cord to peripheral nerves along the muscles of the leg, arms, and elsewhere, called as motor nerves. In most cases of GBS, the immune system damages the myelin sheath. You have to underline this point. So GBS is only damaging the myelin sheath that surrounds the axon of many peripheral nerves. However, it also may damage the axons themselves later on. Okay. As a result, the nerve cannot transmit signals efficiently, and muscles begins to lose their ability to respond to the brain's command. Okay, getting the point. Sensation changes. Since nerve are damaged in GBS, the brain may receive abnormal sensory signals from the rest of the body. This results in unexplained spontaneous sensation called as paresthesia that may be experienced as tingling sensation or numbness, a sense of insect crawling under the skin. Okay, and pain, deep muscular pain may be experienced in back or legs. How does the nerve damage occur? Various ideas have been proposed to explain how GBS develops. One explanation is known as molecular mimicry, or as innocent bystander theory. So according to this explanation, molecules of some nerves are very, very similar to or mimic molecule of some microorganism. When those microbes infect someone, the immune system correctly attacks them. Okay, and if the microbes and myelin look similar, the immune system makes a mistake and attacks the myelin sheath. Getting the point? It's very clear. So different mechanism may explain how the molecular mimicry concept may work. When GB syndrome is preceded by viral or bacterial infection, it is possible that infecting agent has changed the chemical structure of some nerves. That could be one of the point. The immune system treats these nerves as a foreign body and mistakenly attack them. It is also possible that virus makes the immune system itself less discriminating and no longer able to recognize its own nerves. Some part of the immune system, especially white blood cells called as lymphocytes and macrophages, perceives myelin as foreign and attack it. Specialized white blood cells called as T lymphocytes from the thymus gland cooperate with B lymphocytes which origins from bone marrow to produce antibodies against the person's own myelin and damage it. Okay, in some forms of GBS, antibodies made by the person to fight the bacterial infection attack axon in the motor nerves. So in the same way, GB syndrome is one of the several disorders involving weakness due to the peripheral nervous damage caused by the person's own immunity. So let us move further. Miller-Fisher syndrome is in the same way, it comes under this category itself, is a rare acquired nerve disease that is a variant of GB syndrome. It is characterized by abnormal muscle coordination with poor balance and clumsy walking, weakness, paralysis of the eye muscles, and absence of the tendon reflex like GBS. Symptoms may follow a viral illness. Additional symptoms include generalized muscle weakness, respiratory failure. Most individuals with Miller-Fisher syndrome have a unique antibody that categorizes the disorder. Related peripheral nerve disorder with slow onset and persisting or recurrent symptoms include chronic inflammatory demyelinating polyneuropathy and multifocal motor neuropathy. Features weakness that can recur repeatedly over the course of years. Multifocal motor neuropathy typically affects many different muscles in a small parts of a limb. Usually the symptoms are more severe on the one side of the body. How GB syndrome is diagnosed then? The initial signs and symptoms, it's very clear. Physical examination is very clear. So therefore, what happened? Proteins are more seen in cerebrospinal fluid. Just you can go through it. Reflex will be slow. Okay, there is a change in the cerebrospinal fluid that baths the spinal cord and brain in the people with GBS. Researchers have found the measured by the white blood cells. Therefore, the physician may decide to perform a spinal tap or lumbar puncture to obtain the sample of the spinal fluid to analyze. In this procedure, a needle is inserted into the person's lower back and a small amount of cerebrospinal fluid is withdrawn from the spinal cord. This procedure is usually safe with rare complication. So key diagnosis finding includes recent onset, abnormal sensation, absent or diminished deep tendon reflexes, elevated cerebrospinal fluid, elevated cell count. This may take up to 10 days from the onset of the symptoms to develop. Abnormal cell conduction velocity findings such as slow needle conduction. So sometimes a recent viral infection or diarrhea. So how to treat GB syndrome? So there is no known cure of GB syndrome. Okay, there is no certain perfect medicine for GB syndrome. However, some therapies can lessen the severity of the illness, shorten recovery time. There are also several ways to treat the complication of the disease. Because of the possible complication of muscle weakness, problems that can affect any paralyzed person such as pneumonia, blood sore, and need for a sophisticated medical equipments include with GB syndrome are usually admitted and treated in the hospital in the intensive care unit. That you know, right? So there are currently two treatments commonly used to interrupt the immune-related nerve damage. One is plasma exchange, also called as the other name, plasmapheresis. The other is high dose of immunoglobulins therapy. Both treatment are equally effective if started within 2 weeks of onset of GBS. But immunoglobulins is easier to administer. Okay, using both treatment in the same person has no proven benefit. Okay, either they can do plasma therapy, neither are immunoglobulin therapy. In the process of plasma exchange, the plastic tube called as catheter is inserted into the person's veins. So that is the procedure. We will not go through that. Immunoglobulins, Miller-Fisher supportive care, complications, GB syndrome. GB syndrome can be devastating disorder because of its sudden and rapid, unexpected onset of weakness. So it is very rapid, and within few days, the person will get complete paralysis, and usually person get paralysis. Fortunately, 70% of the people with GBS eventually experience full recovery. Maybe only 70% is guaranteed. With careful intensive care and successful treatment of infection, atomic dysfunction, and other medical complication, even those individuals with respiratory failure usually survive, may not be usually. So I have told about acute inflammatory, Miller-Fisher syndrome, acute motor, that I have told. So what is the treatment part? So this is our part of the time where I will be able to explain how we can treat a GB syndrome. So now you understood the virus or the autoimmune system attacks the myelin sheath. Okay, so there is demyelination. Agreed. So the person is paralyzed. Getting. So now we have got only 10 minutes of time to wind up. So I will make it a fast move. So what we are going to do is now that increases possibility of digestion and absorption assimilation. The proper digestion will give a proper autoimmune system. That is, in Ayurveda, what it is been told that, so balancing pitta, it's very much important, because sarva roganam udarahi moolam. So you balance the digestion by Levizine syrup or Kiratamuladi kashaya, or I told Levizine Ayur homeo drops, so which will normalize the Deepana Pachana or digestion process will be normalized. So even though small infection will be removed out. Now coming to treat the basic things, that is, so when there is demyelination, so we have to remyelinate. So what is the best thing you can do to remyelinate? So one thing is, the best thing is that we can use Kshirabala Taila. I used to prepare my own methodology of preparing the Kshirabala Taila, adding along with Balamula, Ashwagandha, Musali, Shatavari, Laksha, milk, and Tila Taila. So this combination along with the Kashaya of Balamula Kashaya. So when we get a multiple benefit of this this Taila, when it is been applied, and when you given along with that Shastika Shali Pindasveda. Shastika Shali Pindasveda, it's a beautiful treatment. That is, you have to take the Navara rice. The Navara means Shastika Shali, or else the rice which is having the coat of a red coating over it. That is vitamin B12 coating. So you boil it, cook it properly, take it in a cotton cloth, tie it tightly, apply this oil. In other part of the time, you have to take little bit of milk, you have to dip it, and after applying it, apply over the skin, legs and back. So that will definitely starts regenerating the nervous system. Getting the point? So one thing you can do in that way. And second thing, fogging with the mother tincture called as Norwegian. That is an Ayur homeo preparation. So ingredients are Balamula, Musali, Ashwagandha, bark of Yukari, Shatavari, turmeric, Guduchi, Musta, Chitraka, 2 drops of Kshirabala Taila, and Kshirabala Taila, which is of 101 Avarti. When you mix it together, when you give it internally, as well as do the fogging or applying. Fogging in the sense, you get a fogger, you add that and spray it. So there will be a mist-like formation will be there. So which will be deep penetrating. So what it happens, as the alcohol has the potency to go within the skin, through the skin, it will carry the ingredients of all the medicinal herbs. So which has the quality of regeneration. So what the thing is that we have regenerated, stop the virus. Okay, so these are the 2 important things which we are giving. And again, I am telling you, rectal ozone will do the great job. It will stop the oxidation. It will stop the fluorination or increasing of virus. So henceforth, the ozone therapy, especially you can give ozone funneling also. But moreover, rectal ozone, my experience in recent times, I have used rectal ozone as a beautiful measure to combat the viral load. Okay, and it will give the oxygenation, intracellular oxygenation will be there. So where the intracellular oxygenation is given, the possibility of virus staying inside will be very lessened, because virus are anaerobic bacteria and virus are most probably does not need oxygen. Whenever you give oxygen, it get vanished off. So henceforth, I am winding up the session by telling the last, but not the least, I am emphasizing of Marma Chikitsa and acupuncture has a 90% role. Apart from even 10% is only whatever the ingredients, what are the medicines, what are all the treatments I have told, but 90% of the job will be done by the acupuncture and Marma Chikitsa. So especially if you know to stimulate the sciatic nerve roots, on and according to the sciatic nerve root, keep on dipping one needle of 2 chin in size and give nerve stimulation. Immediately you can see the beautiful response. One thing. And second thing is that the marmam points like Ultodai Varmam, Mutu Varmam, Uppukutri Varmam, Nyangana Putu Varmam, and Puadangal. These are all, if you are triggering these points with the needle itself, so we get the the energy which is being stored for any other purpose, like for restoring the body, we have to take the stored energy for its utilization. When it comes, so immediate it will help the patient to immediately walk instantly. So that is one point. And also I would like to emphasize upon Tibetan Marmam, where the Tibetan Marmam will be done to the soles of the leg. You apply the oil, Kshirabala Taila, and keep on stimulating with the sticks, whichever it is being given by the Tibetan Marmam. So it affects very beautifully. So these many things I would like to tell you, my dear friends. So by this, easily, even though the patient is being carried to your hospital, within 20 to 30 minutes, the patient can walk away. So within few days, within a week or so, he will be absolutely fine. So when Madhu was there, I was not knowing all these techniques. I just managed with Ayurveda, Shashtika Shali Pinda Seda, along with Kirata Muladi Kashaya. That's it. So only by that, within 4 to 5 days, he was able to do the best of the things. But now I am telling you that within half an hour, the same result we could come back within half an hour. So that's why I am sharing my experience to my dear friends. Okay. So any doubts on this, please, you can ask now. It's a time to ask. If there is no doubts, we will wind up here.
भैया अगर ओजोन थेरेपी नहीं आता है तो?
Okay, so these are the different modalities. See, we are not reaching to a station. मेरा इतना पढ़ना है और नहीं कुछ नहीं पढ़ना है, तो मैं जो कुछ कहे ना 10 years back में जो मेरा पास था, आयुर्वेदा ही था, किराता मूला कषाय ही था और कुछ नहीं था. 5 days में रिजल्ट आया, वही पेशेंट हमको अपना टेस्टिमनी दिया. अब क्या हो गया, आधा घंटे में वो पेशेंट चल के जा सकता है. इसलिए ज्यादा रिसर्च करते हैं, ज्यादा पढ़ते हैं, तो उसका टाइम बहुत कम हो गया. उसको एडमिट करना पड़ता था, षष्टिकाशाली पिंड में करना पड़ता था, कॉस्ट ज्यादा होता था. अभी कुछ ज्यादा कॉस्ट नहीं होने से भी बचा सकता है. कम से maybe within 500 rupees he can go happily, where patient has to spend 5 lakhs in allopathy hospital, IGM, IgG, all those things, 2-3 months, 9 months, beds over that, this and everything. So if you are able to do it within half an hour, so what is the it's a very big thing. So that I am teaching, because whatever the knowledge resides within me, it will be extinguished. I do not know like how when is my death. So definitely if someone or one at least understand this and can do it, so that could be a great thing that which I can do to the humanity.
Exactly. Thank you.
Yeah. Any other questions, please? We are last with only 1 minute.
Can I explain the ozone therapy?
Ozone therapy, actually, I can take one special class because it's very vast thing. How to explain the things? It's very vast. So oxygen is converted into O3. That O3, there is a converter. There from oxygen tank, we convert we get an oxygen generator from which what will happen, that apparatus will convert us O3. That O3 is a gas where you can give IM. Intramuscularly, pain will reduce. Ear, the infection or sinus or something like that, that will reduce. If you give vaginally, the tumor or vaginal any like ulcer, anything like that, it will reduce. Tumor, it will reduce. If you give rectally, peristaltic movement will be there. There will be cancer, colon cancer will be reduced. Infection is reduced. You can give IV. In septicemia condition also you can recur. In case of corona also, if you give this one, fibrosis of lungs also will be reversed. So many beautiful, amazing things are there. If you give ozone funneling also, swelling, everything will be reduced. It's much deep. So we have to give one more hour for that. Okay.
भैया
Yeah.
ओजोन थेरेपी सिखाएंगे आप?
Because there is one
क्लास क्लास
no, ozone therapy. There is Ozone Forum of India. I can share the details. They will teach. They are the authority.